Okay, let us start with the session. First PYQ that we are taking is this MAC band effect is seen due to. Okay, whoever are interested can give me answers in the group. All right, after reading my question. Okay, and then we'll see the explanation of the question. All right, try to answer many questions. Okay, so that it will revise your topics. So first is MAC band effect. MAC or match band effect is seen due to, all right, option A, appearance of different structures with different refractive index on radiograph as light and dark areas. Option B, optical illusion seen in microscopic view of tooth section. Option C, difference in radio density seen in radiograph as shades of gray. And option D, optical illusion due to presence of adjacent light and dark areas on the radiograph. Can you just answer this question and just guess? You can just while guess the answer, I'm going to explain it to you, even if you are not able to answer. No answers? All right. So, MAC-band effect is a optical illusion due to presence of adjacent light and dark areas on the radiograph. All right, it is a optical illusion. Now, I'll just give you a example. No, guys, answer D is a correct answer. What is this MAC-band effect? We'll see. Okay. So MAC-band effect is a basically optical illusion. Okay, our visual system, okay, human visual system presents it as a say this effect. Okay, so just write down MAC-band effect. Okay, was basically given by Ernest Mach. Okay, he gave the first the idea, the concept of McBand effect. Okay, and what he gave is this McBand effect. It is a exaggerated contrast between edges of slightly different shades of gray, meaning what? You have enamel and dentine. All right, the radio density or the contrast between these two structures are different. Like enamel is more radio opaque as compared to dentine, right? So if you look at this image, okay, this radiograph, when you look at this, the outer structure is more radio opaque, which is a enamel. All right, the inner structure then enamel is our dentine, which is less radio opaque than enamel. So it appears like a this line, this radiolucent, the outline of the dentine appears little radiolucent as compared to enamel. Okay, so it represents this matte band effect. This is what matte band effect is. So when you keep two shades of gray adjacent to each other, it will be seen as one line is separating those shades. The same concept is applied over here. Okay, so it is just a visual phenomenon. Okay, visual phenomenon. Okay, and this is due to this effect, or this effect that we see is due to high boost filtering, filtering performed by human visual system. Okay, human visual system, high boost filtering done by human visual system. So what is the answer? It is just optical illusion, okay, between due to presence of adjacent light and dark areas of on the radiograph. Okay, just remember this line is equal to Mach band or match band effect. All right, moving on further, we have least radiosensitive phase of the cycle. Come on, I want answers from everybody. Least radiosensitive phase of cell cycle. This is easy. See, this is a cell cycle. Okay, so we have different phases in the cell cycle, right? Like synthesis phase, G1 phase, G2 phase, and mitosis phase, right? Now, the cells which have more reproductive capacity, okay, will be more radiosensitive. So, radiosensitivity depends on the reproductive capacity of cells. Okay, so in which phase the cells are more reproductive or dividing? Most radiosensitive phase are phase G2 and M phase. Okay, these are most radiosensitive phases. Okay, least radiosensitive phase is the synthesis phase. Least radiosensitive. Okay, and this is less, G1 is less radiosensitive, but you need to remember least radiosensitive and most radiosensitive. Okay, so the answer for this question is option C. Option C is the least radiosensitive phase of cell cycle. All right, moving on further. Third question, a 45 years old female come to OPD with symptoms of burning sensation to tongue, lips and palate. She is hypertensive for last 2 years, taking medicine for it. She also had diabetes, okay, and is taking medicine for diabetes also. And what is the condition called? And they have put a picture of this, okay, put a picture of this. What might be a diagnosis of the condition? Can anybody tell the answer? Anybody? Answer for this question? A lichenoid reaction could be one of the say there is confusion between two options. Okay, so it could be lichenoid reaction due to many drugs that she is taking, but just look at the condition, look at the picture, and look at the two conditions that the lady have. Okay, combining those condition, what could be the answer? Just combine these condition that lady have and tell me the answer. So lady have this lady have this diabetes, hypertension, and the picture that they have given is of lichen planus. Okay, because there are vicum striae. Okay, plus they have mentioned that lady has burning sensation, so it confirms the diagnosis of lichen planus, right? So lichen planus plus hypertension plus diabetes. What is this condition? What is this condition called as? Okay. Uh, okay. So this is basically a Greenspan's condition. Greenspan's condition, right? Greenspan's condition. Okay. Greenspan's lesion. I have taught you people that the difference between Greenspan's lesion and Greenspan's condition. Okay. Greenspan's lesion is another name of which lesion? Can you just recall? Can you just recall? Greenspan's lesion is another name for hairy leukoplakia. Okay. So Greenspan's lesion is synonym or another name for hairy leukoplakia, right? So this option is automatically ruled out. Greenspan's lesion. What is Greenspan's condition? This is a condition where you have a lichen planus plus diabetes plus hypertension. Okay, and uh, there could be a confusion between lichenoid reaction and Greenspan's condition also in this particular question. Okay, so lichenoid reaction can be due to drugs, right? But here they have given two conditions as hypertension and diabetes. So they want us to correlate these three conditions, lichen planus plus diabetes plus hypertension. So your answer is Greenspan's condition. If they would have given only one condition and the drugs taking for that one condition, then our answer would have been a lichenoid reaction to that particular drug. But since they have mentioned two conditions and the lichen planus, the features of lichen planus, then our answer is option C, which is Greenspan's condition. All right. Okay. Proceeding further, yeah, I have just put up this chart where these drugs shows lichenoid reaction. Okay, so drugs associated with lichenoid reaction, this we have also discussed in our live session. All right. So if you want, you can take screenshot or you can write this down. All right. Let's move on further. Okay, question 4. The magnetic field used in dentistry. So, magnetic field is used in which radiographic technique? Can anybody tell me? Magnetic field used in which radiographic technique? Can anybody tell me? Magnetic field used in dentistry. But you should know what magnetic field is used in which technique first. Anybody? No? So, MRI, which is magnetic resonance imaging, right? Right. Magnetic resonance imaging. So, MRI uses this magnetic field. Now, there are low field MRI scanners, high field MRI scanners, and ultra high field MRI scanners. Okay. So, there are low field MRI scanners, high field MRI scanners, and ultra high field MRI scanners. Okay, there are types of MRI scanners. All right. Now, low field MRI scanners uses the magnetic field between zero point 0.3 to 0.3, 0.23 to zero point 0.3 Tesla. Okay. High field MRI scanners uses magnetic field between 1.5 to 1.3 Tesla. And ultra high field MRI scanner uses magnetic field up to 7 to 10 Tesla. Okay. But our answer or the magnetic field that is used in dentistry is this high field MRI scanner is enough for dentistry. Okay, so 1.5 to 3 Tesla should be our answer. But since they have given the range, okay, so our answer for this question is option A, which is between 2 to 4 Tesla. Okay, so this range covers in option A. All right, so our answer is option A. Okay, let's move on further. Question 5. Blood urea nitrogen level for uremic stomatitis should be above. Blood urea nitrogen level for uremic stomatitis should be above 50 mg per dl, 75 mg per dl, 100 mg per dl, and 150 mg per dl. Okay. If anybody knows answer, can send it in the group. Otherwise, I'll tell you the exact answer. Okay, so basically you should know this uremic stomatitis occurs in advanced renal failure. Okay, it occurs in advanced renal failure. Okay, and the elevated blood urea level, blood urea nitrogen level. One is blood urea nitrogen level. Okay, should be above 150, should be above 150 mg per dl. Okay, so basically it should be 150 to 300 mg per dl. So our answer is option D. Okay, so in uremic stomatitis, blood urea nitrogen level goes beyond 150 mg per dl. All right, and what will patient complain of in uremic stomatitis? Uremic stomatitis, patient will complain of dysgeusia. Dysgeusia is weird taste, okay, or altered taste, okay, or bad taste. And then patient will have a burning sensation of tongue and lips. Okay, burning sensation in tongue and lips. So these are some say um, clinical features or oral symptoms that patient will tell you. Okay, and what in uremic stomatitis, what happens is there is an inflammation of oral mucosa. Okay, due to high blood urea nitrogen level, what happens is inflammation of oral mucosa. Okay, associated with renal function and urea accumulation. All right, so just remember this. You just have to remember the level, the um, this numeric, okay, for this question. Moving on further, we have question 6. The metastasis in oral cavity is seen most commonly from. Okay, can anybody answer? Option A lung, option B liver, option C renal, option D colorectal. So metastasis in oral cavity is seen most commonly from. Can anybody answer? Can anybody answer? Yeah, correct. Option A is the answer. Okay, so common sources of metastasis, if the primary tumor is somewhere else, okay, and it is say it is coming to oral cavity, the metastasis is happening in the oral cavity. The common sources are breast, lung, right, correct, everybody. Breast, lung, kidney. Okay, these are most common sources. Okay, and which is the most common site? Mandible is the most common site in the oral cavity of metastasis. Site of metastasis. Okay, correct. Next option, sorry, question 7. A 20-year-old patient having history of tobacco quid. Okay, when you read question, you just underline the question, the important terminology that you think can be important or will be used in diagnosis. Okay, so 28 years old patient having history of tobacco quid habit for last 5 years has growth over right cheek. So they have put a picture. Okay, this is a growth over right cheek. Now they have given histopath showed Acanthosis, palisaded epithelium, keratin pearls in epithelium, connective tissue showed chronic inflammation. The diagnosis is now this is most a pathology question because they have mentioned complete histopathology. But if they give you image based question and tell you the most common malignancy involving buccal mucosa, so your answer should be option C, which is squamous cell carcinoma. All right. Squamous cell carcinoma is most common malignancy that can occur in the oral cavity. Okay. Correct. Correct, everybody. Okay. And leukoplakia, we all know precancerous lesion, right? Precancerous lesion. Okay. Right. No, option D is leukoplakia. It is not this case. Okay, leukoplakia will have this cracked mud white lesion, white patch or plaque. All right, and will have a cracked mud appearance. Okay, if they have given homogeneous, then answer would have been a leukoplakia. Okay, but here the answer is option C. Okay, next, moving on further, we have benign pathology caused by HPV, human papilloma virus is. So they have given some options. Among these options, you have to choose which benign pathology is caused by human papilloma virus. So option A, molluscum contagiosum, option B, condyloma acuminatum, option C, varicella, and option D, cervical carcinoma. So if you know the answer, then you put it in the group. Otherwise, I'll tell you. Benign pathology caused by HPV virus. Okay. So HPV basically belongs to uh, I'm sorry. Yeah. So HPV belongs to Papilloma viridae family, right? And HPV have group or HPV have hundreds of subtypes. All right. Hundreds of subtypes. Okay. And which two are most important subtypes? HPV. Yeah, correct. Correct. Option B is the correct answer. Okay. Condyloma acuminatum is a benign pathology caused by HPV. Now, HPV, the most important types are HPV 16 and 18. Okay. They are responsible for oropharyngeal or tonsillar carcinoma. Okay. But benign pathology caused by this human papilloma virus is first verruca vulgaris. Second one, oral papilloma. Third one, focal epithelial hyperplasia. Hyperplasia. Okay, it is called as Hex disease also. All right. And then fourth one we have is the condyloma acuminatum. Condyloma acuminatum. Okay. So our answer for this question should be option B. Condyloma acuminatum is a benign pathology. Okay, with that, we have also three other benign pathologies that you should remember. So, if in place you have this verruca vulgaris as an option, your answer is verruca vulgaris, right? So, just remember this. Okay, next, yeah, this I have just put up the picture of this condyloma acuminatum oral warts like thing, exophytic growths that you can see. Moving on further, question 9. Patient reported with multiple eruptions on face of short duration. Like, so we have acute uh, multiple eruptions, right? Intraoral examination reveals large ulcers with bone exposure. Okay, large ulcers with bone exposure. On culture, what we find out is Borrelia vincenti. Okay, Borrelia vincenti was isolated. What is the diagnosis? Now you have this acute multiple eruptions on face. Large ulcers with bone exposure. On culture, what organism you're getting? Borrelia vincenti. Okay. Option A, Noma. Option B, Ludwig's angina. Option C, pyogenic granuloma. Option D, tuberculosis. What is your answer? What should be your answer? Yeah. Option A is your answer, which is Noma, which is a bacterial infection, and the organism that we have given in the question is Borrelia vincenti, is a bacteria. All right, and it causes this infection causes no, called as Noma, or it is also called as cancrum oris, right? Cancrum oris. Correct. Everybody correct. Cancrum oris, it is called as. Okay. And Borrelia vincenti is one of the organism, and the second organism that we have is fusospirochids. Fusospirochids. Okay, so these two bacteria causes this Noma or Cancrum oris, which is a bacterial infection. Okay, and basically it is rapidly spreading gangrene, and it is consequence of what? NUG. Okay, NUG is necrotizing ulcerative gingivitis. Then comes on to NUP, which is necrotizing ulcerative periodontitis. And then we come on to this Noma, Cancrum oris, which is this severe infection which causes this gangrenous infection and causes bone exposure. Okay, all right. Moving on further, we have 10 years old child has a bilateral progressive swelling in mandible. Okay. Uh, Not maxilla, just delete this. Okay. So 10 years old child has bilateral progressive swelling in mandible, which has been present since 4 years of age. Okay. So mark this as a important bilateral swelling in mandible. Radiograph reveals multilocular radiolucencies in both jaws. Now, both jaws say in mandible only you take in mandible both side bilaterally. Okay, and loose and displaced teeth. Okay, presence of loose and displaced teeth is present. Okay, what is the diagnosis? A. Paget's disease. B. Hyperthyroidism. C. Cherubism. D. Fibrous dysplasia. What should be the answer? 10 years old child. Now look at the features they have presented. Bilateral swelling. Mandible is affected. Multilocular radiolucencies. Okay. Bilaterally. And then loose and displaced teeth. Okay. Yeah, correct. Option C, cherubism is the answer. So, cherubism occurs in a child less than 10 years of old, bilaterally involved mandible, most common site, and multilocular radiolucencies are seen like this. Okay, on both the sides, bilaterally, you will see this multilocular radiolucency, and there will be floating tooth appearance, loose and displaced teeth. Okay, floating tooth appearance is also characteristic feature seen in cherubism. All right, correct. All right. on further, we have a 57 years old patient reported with bilateral swelling of jaw. Okay. On radiographic examination, generalized hypercementosis of dentition was observed. Which of the following will confirm the diagnosis? Look at the age, look at the feature of swelling, look at the another feature that they have given. What should be the diagnosis? A. Serum alkaline phosphatase. Which of the following will confirm the diagnosis? Okay. A. Serum alkaline phosphatase. B. Paget's disease. C. Hyperparathyroidism. D. Fibrous dysplasia. Can you answer? Just read the question very carefully. All right. Read the question very carefully. Okay. If you read it very if you try to give answer very like in hurry, then you might go wrong in this case. Okay. Only one person has answered. Okay. Yeah. So they have mentioned here which of the following will confirm the diagnosis. They have not asked what might be a diagnosis. Okay. So serum alkaline phosphatase, option A is our answer, which will confirm our diagnosis. Okay. So serum alkaline phosphatase will be increased in this case. Okay. If it is increased, then our answer is Paget's disease. Not answer, the diagnosis. Okay. So the features they have mentioned are of Paget's disease. So Paget's disease occurs in 40 years old patients. Okay. Bilaterally. Okay. Maxilla commonly uh, affected, right? And then what is the feature of Paget's disease? It occurs below inferior alveolar canal, right? Below inferior alveolar canal. Just write down the features of Paget's disease so that it becomes easy if they mention such features. Leonine facies is one of the feature, right? And what is the appearance seen in the mandible radiographically? It is cotton wool appearance. Cotton wool appearance, right? So these all are features of Paget's disease that you should know, right? And here the our answer is serum alkaline phosphatase will confirm the diagnosis of Paget's disease. Generalized hypercementosis is also one of the feature, right? Seen in Paget's disease. Moving on further, we have question 12, which is what will you do to treat a T1, that is less than 2 centimeters of tumor in cheek? A. Surgery. B. Chemotherapy. C. Radiotherapy. D. Multimodal therapy. Can you answer? Yeah. Lincoln Beard sign is seen in Paget's disease in radionuclide imaging. Okay, radionuclide imaging. Lincoln's Beard sign is seen in Paget's, right? What should be the answer here? When the tumor is less than 2 centimeter, less than 2 centimeter tumor can be treated with, yeah, correct, surgery. Option A, surgery is a correct answer. If they would have given, say, this tumor of this size having a metastasis, okay, or lymph node involvement, okay, then our answer would have been multimodal therapy. That patient then will require chemotherapy as well as radiotherapy as well as surgery, right? So according to the stages, according to the lymph node involvement and metastasis, we deliver a treatment plan to a patient. Okay. Moving on further, question 13. A mother came with 10 years old daughter which had an infection 2 years back near preauricular region. Okay. A child shows mandibular asymmetry with chin deviated to right side on opening the mouth. The child has recently developed a difficulty in feeding and mouth opening. What is the diagnosis? A. Condylar hypoplasia. B. Left side TMJ ankylosis. C. Right side TMJ ankylosis. D. Bilateral TMJ ankylosis. What should be the answer? And they have also given clinical pictures, so it becomes easy for you to judge. I'll just give you the thing, the reference, that this is a right side and this is a left side. So right side, this is left side. Yeah, correct. Option C should be our answer. Right side TMJ ankylosis. Now, if you look at the clinical picture clearly, okay, the left side shows flatness, right? Left side shows flatness, means normal side. Okay, and the fullness is seen on the right side. Okay, this fullness is seen on the right side, right? And when patient tries to open mouth, the chin is deviating to the right side, right? Meaning left TMJ is functional here, left TMJ is functional, right? Chin deviating to right side means right side is ankylosed, right side is ankylosed. So our answer is option C, right side TMJ ankylosis is happened in the child due to infection. Okay, all right, correct. Uh, Yeah, I have just put up this picture radiograph also where you have this coronal section of CT, CBCT, right? On the right side, if you can see, there is a bone formation that has occurred between the fossa, glenoid fossa, and the condyle, right? And left side looks normal. There is a space between this. And here you have this bone formation. All right. Okay. Moving on further, we have a patient reported to the OPD. He had pancytopenia. Hemoglobin was 6 gram. Hepatosplenomegaly, bleeding gums, and sternal tenderness. What is the diagnosis? Option A, acute leukemia. Option B, ITP, which is idiopathic thrombocytopenic purpura. Option C, iron deficiency anemia. Option D, aplastic anemia. What is the diagnosis? Aplastic anemia, right? So, aplastic anemia, okay, is a blood dyscrasia, right? Blood dyscrasia. All right. And what happens here is complete absence of cellular elements of blood. Okay. Complete absence of cellular elements. All right. So there will be pancytopenia, thrombocytopenia, right? And there will be leukopenia and everything. Okay. And the clinical manifestations are related to this. So pancytopenia will cause pallor, chest pain, dyspnea, and fatigue. Okay, thrombocytopenia is related to drug. Okay, sorry, bleeding. Okay, bleeding, hemorrhage. So bleeding gums, right? Petechiae. Then bruising will increase. Leukopenia will cause infections and fever. All right. So these are some, you can say, the clinical manifestations due to thrombocytopenia, due to leukopenia, due to pancytopenia. Yeah, due to and due to which we have hemoglobin. Hemoglobin is also decreased. in aplastic anemia. All right. So our answer in this question is option D, which is aplastic anemia. Okay. Acute leukemia, what happens in acute leukemia? There is gingival enlargement that happens. Okay. There are leukemic infiltrations due to leukemia. Okay. All right. Moving on further, we have a patient shows development of malar rash on face with photosensitivity and intraoral ulcers. What is the diagnosis? By looking at picture or by looking at this term only, you should be able to answer this question. Can you answer? Can you all answer? What is this malar rash? Where do you see this malar rash? Correct. SLE. SLE is systemic lupus erythematosus, right? SLE, the malar rash is the classic sign or classic feature seen in SLE. And how the intraoral ulcers are? Intraoral ulcers looks like we have SLE and DLE, right? DLE, which is discoid lupus erythematosus. So inside it, we have erythematous area, and surrounding it we have white. I'm drawing it with the black, white, this striations, brush border type lesion, right? Brush border, white striae originating from the center to periphery and appears like a brush border. Okay, these are the lesions seen in intraorally, and on skin the malar rash is the same, the classic sign seen in SLE. Okay, moving on further, we have 16th question, which is all radiographic techniques are used to detect zygomatic fracture except, come on, all radiographic features are used to detect zygomatic fracture except which radiograph? Can you all answer? Which radiograph is used to detect some other part than zygomatic fracture? No answers? Shall I? Correct. Option B, reverse towns. Reverse towns is an option. Reverse towns is used to detect fracture of high condylar neck. Correct. Okay. So reverse towns is our exceptions, is not used to diagnose zygomatic fracture. All right. So our answer is option B. Correct. Okay. Moving on further. Yeah, I've just put up this reverse towns radiograph, which is used to detect high condylar neck fracture. Okay. 17th question, identify the pathology seen in the radiograph. Look at this pathology. What should be this? Option A, internal resorption. Option B, external cervical resorption. Option C, Lyong's premolar. Option D, dens in dente. What is your diagnosis? Come on. Option A, correct. Option A is our answer. This is internal resorption. Internal resorption is uncommon resorption, starts in the canal, root canal, and will destroy the surrounding tooth structure. Correct. Everybody correct. Okay. And when you get confused between this dens in dente and internal resorption, look at how dens in dente will look like. Okay. This is dens in dente. Okay. Dens in dente is what? Dens in dente is a developmental malformation where this invagination of enamel organ occurs into dental papilla, right? Dens in dente is invagination of enamel organ into papilla, right? Into papilla. So this is how dense indentate looks like. All right. Okay. Moving on further, triad of hypoxia, hypovascularity, and hypocellularity with infective foci leads to option A, NUC, option B, osteomyelitis, option C, Gary's osteomyelitis, option D, osteoradionecrosis. Come on, fast. Hypoxia, hypovascularity, and hypocellularity are associated with which entity? Correct. Option D, ORN, which is osteoradionecrosis. Okay, osteoradionecrosis is when the irradiated bone is exposed to any trauma. Okay, that time what happens is there is effect on blood vessels, leading to decreased blood supply. Okay, and mandible is most commonly affected here in this, and there is a uh, entity called osteonecrosis can takes place. Okay, and this risk of osteoradionecrosis can be decreased by removing all the infection before undergoing radiotherapy. Okay, so these are the features seen in osteoradionecrosis, right? Question 19, identify the radiopic structure seen in occlusal radiograph. Okay, can you just appreciate these radio opaque masses? Radio opaque mass. What are these? Option A, silolith. Option B, dislodged prosthesis. Option C, fractured segments. Option D, artifact. What are these radio opaque masses? Irregular in shape. Correct. Okay, so these radiopaque structures that we see over here are siloliths. Option A, siloliths. Correct. Correct, everybody. Okay, so these siloliths are idiopathic calcification, and most common duct or gland which is affected here is submandibular gland. Okay, so siloliths are mostly affects or get accumulated or occurs in submandibular duct or submandibular gland. Okay, let's move on to the last question of the day. An adult patient reported with facial asymmetry, derangement of occlusion, deviation of chin from last few days. What will be the diagnosis, or uh, what diagnosis, what investigations would you prefer for this patient? So patient have asymmetry, facial asymmetry, derangement of occlusion, and deviation of chin from last few days. What would you advise? What investigations would you advise? PET scan, MRI scan, CT scan, incisional biopsy. Okay, so would you suggest PET scan, MRI scan, or CT, or only MRI and CT, or on MRI, CT, or incisional biopsy, or PET and CT? What would you suggest? What two important investigations you will suggest to patient with these features? Um, think, think, think. I'll tell you the thing that only two investigations are needed among these. Only two investigations. Now, which are those? Tell me. Which are those? No. Guys, option B. B and C. MRI and CT scan will you will suggest. Okay, so PET scan is basically we suggest for in cases of metastasis, in cases when you are suspecting increased metabolic activity, or any bone disorder, okay, or any metastasis. If you are say if you are um, confused whether there if there is any kind of metastasis happen in the body, okay, that time you suggest PET scan. But here, according to the features, this patient might have a fracture, okay, fracture and soft tissue swelling. Okay, for soft tissue swelling you will advise MRI, and for fracture detection you will advise CT scan. Okay, so the correct answer for this question is option B, which is CT and MRI. Okay, I hope you understood this. Incisional biopsy is ruled out. Okay, um, because there is no mass, or there is no precancerous lesion or anything like that. Okay, and PET scan is ruled out. If there is a fracture, there is no need for PET scan. If you suspect there is any metastasis or increased metabolic activity, then you can advise PET scan over there. All right. Correct. Option B is your answer. Okay. I hope you enjoyed this PYQ session. Okay. Many of you answered correctly. Yeah. And keep studying, guys, till your exams. And all the best for your exams. We'll meet in next session, hopefully. Okay.